When we were talking about the urinary system, we were also talking about the bladder, and the bladder functions to store urine, and the emptying of the urine has a specific term, which is called micturition. So micturition is essentially just urination. And so homeostatic imbalances in this happen frequently, where we have, for example, urinary incontinence. So this would be, for example, if you have urine leaking out when it shouldn't be leaking out, this can cause a problem. And there are a few different reasons for it. So when we look at this micturition, it has to do with the bladder, and the muscle in the bladder is called the detrusor muscle. This is an example of a smooth muscle. And smooth muscles are involuntary control. So we have involuntary control. Now, with the bladder, we actually also have sphincters. So you might remember the discussion of sphincters when we were talking about the digestive system. So those are circular muscles that help to keep fluid from moving. And so we have what is called the internal urethral sphincter. And we have the external urethral sphincter. So the internal urethral sphincter will actually open up when the bladder wall contracts. And however, urine won't exit the bladder and go into the urethra until the external urethral sphincter opens. So this is involuntary, but this is voluntary in most cases. Although under extreme fright and fear, sometimes people will pee their pants. And that has to do with the limbic system kind of overriding your conscious ability to control urination. And so you will urinate just because of your emotional reflex. Your limbic system is your emotional reflexes. So when we look at this, we could look at it in the males. So this is my bladder, and it can expand as the urine comes in from the ureters. This epithelial tissue that surrounds or lines the bladder is actually called transitional epithelium, and it is able to incorporate or expand. Now, with the expansion of the bladder, something happens, and that is that we have stretch receptors in the smooth muscle. So we have stretch receptors, and these are mechanical receptors. They're modified neurons that can detect when stretch occurs, and these stretch receptors will cause the bladder to contract when that muscle is stretched. So when the bladder is stretched, the bladder will contract. And this is actually under the rest and digestion part of our autonomic nervous system. So this is actually, when we look at the autonomic system, which is involuntary, we have the parasympathetic, which is rest and digest, and then we have the sympathetic, which is fight or flight. So this is actually parasympathetic. So that is, the parasympathetic actually has a cranial sacral outflow. So for those of you who took biology 232, you might remember what we talked about. And so there's actually nerves that go from the sacral region of your spinal cord. They actually come out and they innervate the bladder, and they cause the bladder to contract. Now, this is when you feel like you have to urinate. And so this causes like this feeling of, I need to go to the bathroom. And one of the really interesting things is if you do not go to the bathroom, if you do not urinate, after a while, the bladder will relax. So without voiding the bladder, the bladder will relax. And you're like, I thought I had to go to the bathroom, and I guess now I don't, right? And so that relaxation of the bladder gives you this false sense that you really don't have to go to the bathroom. And then 5 minutes later, you have to go to the bathroom, which is why it's always a good idea if you're traveling with children or older people, you just make everybody go to the bathroom, because it could be that 5 minutes, in 5 minutes, your bladder is going to start contracting and you're going to need to pee, right? You're going to need to urinate. So when we look at the internal urethral sphincter, that is located right here. So that opens up, but we want this external urethral sphincter to stay closed. And you'll notice that it actually goes through a muscle called the perineal or the peritoneum. So this peritoneum or perineal muscle, so the external sphincter remains closed unless you consciously decide, and this actually takes some training, right? So this is why babies can't control their urination initially. So the urethral sphincter is in the perineal muscle. And so that's like your pelvic floor. So this pelvic floor, this muscle right here helps to keep urine from coming out. And so if it does start to drip out, that becomes a problem, and that's incontinence. And one of the things that you can do is to help to strengthen this perineal cavity, or perineal, muscle, is to do what are called Kegel exercises. So Kegel exercises help to strengthen that muscle and help to prevent incontinence. So that what that is when you feel like you have to go to the bathroom and you squeeze and you lift up on the pelvic floor, that is going to keep that muscle in shape. So we actually have to kind of work that muscle in order to keep it well. And also one of the problems that sometimes happens is as we get older, we might have like herniations in our low back. And when you have herniations, it can press on the nerves, and it sometimes makes it, those nerves don't do the right thing. So for example, a herniated disc in your back could lead to problems with incontinence. You'll also notice that here in the male, the urethra travels through the prostate gland. And so in males, this enlargement of the prostate gland, which is very common in older people, can lead to problems with urination. And so older men sometimes have a trouble urinating because this gets closed off. And so then they would have to go in and open that area back up so that urine can come out. And then again, the urine has to travel through the penis. And then this is the external urethral orifice right here. So if we look at the females, you'll notice that in the female, the urethra is much shorter. So this urethra is much shorter, and it is actually the external urethral orifice is closer to the anus, which is why it's very important to wipe properly, where you wipe from the front to the back, because you don't want to get bacteria coming into the urethral orifice, because that will lead to urinary tract infections and will also possibly lead to bladder infections, and then also maybe even to kidney infections, because these are all connected. When we look at the lining, that transitional epithelial tissue can expand when it is stretched. We also see here the detrusor muscle. And then there's like this trigon area where you'll notice that the ureters don't come in the top. They actually come in right here. So the ureters are transferring urine from the kidney to the bladder. So the trigon area is this region right here, and then these regions, these two openings right here. So that is control of urination and the anatomy of the bladder, the ureters, and the urethra.